badass queens in the pink velvet chairs, holding your feet to the fire while you're sitting there, talking about what you did and how you did it, spilling all the tea on your business on the Credentialing Chronicles.
And
Welcome back.
here we are. We're so excited.
Shannon. Yes.
Spilling tea all over the United States.
And where are we at now, Shannon?
I mean, the biggest state of all, right? Well, no, is Alaska bigger? California. No, Texas, I think, might be even bigger. I don't know. Anyway, California, honey.
Oh, well, California. It is the state with the most doctors,
Yes.
the biggest Medicaid program in the country, the
Big.
thickest rule book, and the most oversight. So
Wow.
tell me why. Tell me
Okay.
why we are drowning in fraud settlements, collapsing hospitals, and patients falling through cracks big enough to basically drive a DOJ subpoena through it.
Wow. Because having rules isn't the same as having control. Let's be honest, right?
Exactly. So today's tea is not just about one bad doctor. It's not even about one bad hospital. I know we did that last episode, but this is actually about a system that looks credentialed but keeps failing the people it's actually supposed to protect.
Yeah. I mean, it's let's be fair, right? Okay. California actually has one of the most transparent licensing systems in the country. And I will say it every single day. We talked about it when Emily was with us. The Medical State Board of California website is solid. Not even the medical board, the way they individualize the boards, they really, we're going to have a, link to the board on this episode. So if you're in California, make sure you go and check out your doctors before you go see them. And they also, for credentialing people in California, they have what's called the 805 report. And the 805 report, you have to email their licensing people over there, which is the same guy that's been over there forever. Oh, maybe I could reach out to him and ask him if he could be part of our bonus feature. Because I've been with them, over 8 years. So he knows me pretty well. Because every year you have to get recertified, why you need access to that system.
Okay.
When you get into the system, it goes over malpractice, and tells you any little thing that they have. So it's a little bit further than just checking them up on the public document lookup. It's kind of like a little back door. So if you're in the state of California, and you are certified by AAAHC, Joint Commission, NCQA, you are mandated to be getting this 805 report because it's part of their state law. And, you have to follow the state laws. So just, little
So that's
tip
actually
and trick.
a really good. Yeah, that's actually a really good idea. So I took a look at their board website, and what I really liked about the medical board website is very easy. You go to the main page, right on the top right, you have a license search. I mean, isn't that great for transparency as a credentialing person?
Yeah. You can easy to file a complaint, easy to check up on your doctor's license. Yes. And that's what you really want to see from all the states. I mean, that is our advocacy. That is the soapbox we stand on. Okay. So when you say, where is Nylene and Shannon? We're over here on that soapbox.
Yeah. And I love the fact that, like you said, you can actually click on file a complaint to the medical board. Yeah, I don't really see that on many sites, especially not as big as it is on the medical board website.
Not easy.
So I love that. And, that matters because honestly, transparency is step number one, right? As a patient, you can look up your doctor right now. You can confirm an active license. You can see disciplinary actions. You can view accusations and enforcement history,
Yeah.
Doctors can find like license status and expiration, public discipline, accusations that follow you, all kinds of stuff, right?
Yeah. It's a tool. It is a tool that they have created, and it's not just for credentialing experts. It's for the population, and that's what we want to see from medical boards. I mean, that's the best thing that they can do, right?
Okay, so now that we gave him some kudos, let's
Yeah.
just talk about the real tea.
Ah.
Here's the first warning sip. All
Okay,
right.
tell us.
A license only tells you if someone can legally practice.
True.
It does not tell you who's incentivizing them, who's auditing their billing, or who's watching utilization patterns, or who's actually ignoring the red flags. Right? What else? I don't know, Shannon. Like, what else can like not having a license? What else can it hide? I don't know. What do you think?
I mean, yeah. I mean, it's it can hide how they treat people in the OR, how they
That's
treat people
true.
in the organization, how they act as a team. It can't hide, it can hide their medical knowledge, and it can hide any type of deviant behavior. I'm sorry, but I have to say it.
You're right. Yeah, absolutely. Absolutely. So let's talk about some tea. We got some scandals going. Follow the money. Let's talk managed care, specifically a health plan, a particular health plan in the state. In 2025, the DOJ sued this health plan for allegedly misusing ACA expansion funds,
Okay.
creating fake incentive programs, inflating rates, and keeping Medicaid money they were legally required to return.
What? And this is important. I mean, this wasn't like, bedside care. I mean, it's not the people at the bedside. It's not the people fixing the meals. It's not the people, right? It's in the administration department, the admin. And that is what?
So wait, for a translation of the people in the back, money meant for patient care was allegedly turned into like paperwork magic. No nurses hired, no clinics expanded, just like accounting. I guess you could say like accounting gymnastics, right? It was just crazy.
And really, managed care systems were put in place, you all, to stabilize systems, to help a population of patients that were at high risk from becoming even more high risk, or everyone downstream pays when these people are out here profiting from these unfortunate situations, right?
Yeah, and it just really like, I don't want to use the word sucks, but like it really is horrible how we manipulate the system or the billing system or the billing practices to try and accomplish something, and it just ends up hurting the patient, hurting the overall system, and the funding that's available. So let's talk about rural California, because as populated as California is, there is still a rural side of California. So before we go any further, we need to talk about who actually gets crushed when Medi-Cal gets shaky. Now, when we talk about that, that's like the Medicaid, I guess, of California. A spoiler alert, of course, it's not the executives.
Yeah.
Of course. Yeah. So let's talk about a 65-year-old.
It's unbelievable.
Right. So let's talk about a 65-year-old who lives in Colfax, California. I don't even know where that is. So if y'all are from California, please let us know. Like, what do you know about
Chime in
Colfax?
below. Chime in. Tell us. North, south, east, west. Tell us.
Yes. So this poor woman, cares for a 16-year-old grandson that has severe intellectual disabilities, an 18-year-old grandson that has autism. And because of Medi-Cal and this IHSS program that they have, she's able to stay at home. Her grandson receives care, and her Medicare premiums are covered. So, you apply, you put in like all this stuff that you have, and she gets approved, right? So without this system, of course, there's going to be chaos, because how can a 65-year-old retired person
that's what I'm wondering.
has to care for all these people, like how is she supposed to fund all of this? Now, I don't know. This is why we have this healthcare system in place.
Yeah, and I mean, let's be honest, right? It's not emotion, right? It's arithmetic.
Mm-hmm.
You know, I mean, I just don't even understand
Right.
what the
So,
heck. What the heck? What the helly? That's what the kids are saying nowadays.
oh, really? I don't know that one.
Yeah. Yeah.
So Congress has floated 880. Hold on, I have to say this again
I can't
because
even like
believe
what?
this number.
880 what? Coins?
Billion, girl. I didn't even know there was that much money. Like what? I'm so confused.
Hey, that's a lot of money.
billion.
Where is that billion? Oh my God.
I don't know. That's a lot of billions.
Everything is
girl.
billions now. Everything is billions.
So
Everything.
880 billion, 880 billion dollars in
Dang.
Medicaid cuts over the next decade in one
That's a lot of
California
billions.
district alone. So
One district?
in only one district, okay, 1 in 4 residents on this Medi-Cal, which I guess that's what they call Medicaid, and y'all
Yeah,
need
it's
to correct
Medi-Cal.
us if we don't.
It's called Medi-Cal.
Okay, it's called Medi-Cal. So Medi-Cal. So just you talking about 2.25 billion spent in 1 year, over 10,000 recipients, 1,500. Oh, which actually, let's talk about this whole system. 1,500 kids in foster care. So
Yeah.
children in foster care get Medicaid for life, right? Get Medicaid for forever. I don't know how long,
Yeah.
but
Yeah.
until they're 26, I believe, just like it's like health insurance. I don't know. Y'all need to correct me on that. Anyway, you're talking about 7,000 people with developmental disabilities.
Yeah.
So you're talking about an entire infrastructure of people.
That it has a problem. That literally has a problem. I mean, if you're looking at it, there's another, institution, Eastern Palmas Healthcare. 1/3 of their patients are literally on the Medi-Cal system. 30% are over the age of 65, so elderly we're talking. These people are without Medi-Cal. They are 50 miles to Reno, 150 miles to Sacramento. I mean, they are on mountain roads in the middle of nowhere.
So if they do these cuts, what does the CEO say?
Yeah, I mean, he's saying without supplemental payments that they're going to run, into deficiencies every single month, and that they don't know how to sustain it all.
So then who gets affected? Whose services disappear? That we always talk about.
Well, I mean, hello, it's the patients. And here it is. To be honest, they're not even talking about all the problems. What providers want to go out there to the mountain roads? It take a special person that wants to travel. And when you find that person, you have to kind of love on them, make sure you're not putting them in a corrupt situation. I mean, that's, I think, something big to think about, right?
Right. So then it's like a huge domino effect, because what happens is when there's all these cuts and the government talks about all these cuts or whatever, like, listen, these are not people that can help themselves. There are people who are retired, who have paid their dues, who have worked in society, and they just got dealt a shorthand. I mean, I'm sure that 65-year-old woman did not want to take care of her, teenager grandkids or whatever. And she's just kind of like stuck in this situation, right? I'm sure a kid that's in foster care didn't choose to be a foster child, right? So when you do all these cuts, you're cutting cuts to vulnerable people that need assistance from a system that's designed to supposedly help people, but we continue to this cut funding. So here's what policymakers never say out loud. When things like Medi-Cal funding shrinks, clinics obviously can't hire, because we all know, I mean, like I said before, sarcastically, healthcare workers, right? Because we make so much money.
Yeah.
No, we're severely underpaid. I'm sorry.
Yeah.
Anybody that works in healthcare understands we are severely underpaid.
Severely,
anyway, So when Medi-Cal funding shrinks, you have clinics that can't hire, you have appointments that go away, patients that have to wait months to be seen, chronic disease that worsens because I can't get timely care. And who takes the overflow is your emergency rooms. Because if you don't have insurance, we talked about EMTALA before, right?
Yes, exactly.
So
Everybody's
when you
going
need
to the
emergency
ER.
care, everybody's going to the ER. So what happens in the ER? What do we see in the ER then?
Yeah, I
Right?
mean, what do you get? Longer wait times. You get higher uncompensated care. You get more uninsured patients showing up. And that doesn't cost, that costs more than Medi-Cal ever would cost if it just worked and corrected. If it worked the way that it was supposed to, right? Cuts don't save money every time. We always are seeing that. I mean, what they do is they delay catastrophe. There has to be some investment in people. There has to be some investment in communities. Has to be investment in states. I mean, and when we get into 880 billion, I feel like some of them billions could have went to patient care. Come on, y'all. Come on.
Right.
Nylene, tell them.
Right.
Tell them, Nylene.
I know. So let's just continue talking about billing, because billing, claims, fraud, I mean, this is all a part of credentialing that we need to discuss. Is California itself in 2024, the HHS OIG found the state improperly claimed $52.7 million in federal Medicaid funds by using outdated cost calculations and billing tied to immigration status categories incorrectly. So can we just hold on? We need to pause for a minute. So when a patient is admitted, hold on. When we admit a patient to a facility, because I used to work at surgery centers and I used to work at registration at a hospital, we ask for socials because we have to report the socials on our quarterly reports to the state.
Yep. Tell me.
And so does that correlate to like an immigration status? So are we like falsely documenting immigration statuses in order to receive a different kind of funding? I'm very confused. Somebody needs to enlighten me, because it's whether or not people deserved care based on immigration status, Shannon. Like, do you know anything about this? Because I don't. I mean, like, literally doing research for this episode is where all of this was brought out, and it's a very political and very controversial thing. But I can tell you guys, I am required by a facility to collect social security numbers and report it to the state, which automatically correlates to whether you're documented or undocumented. And I do know that that is part of my state reporting. At least for the state of Florida, it was.
Well,
do you have any experience with that?
Well, I think some of the research that I had done about the SNAP benefits was that they didn't want to pay SNAP benefits to the states that didn't report immigration status of certain people. And so that's kind of why all of that had kind of stopped, is because, I think the Democratic states didn't want to report it, or I mean, I don't know all the facts, but or maybe the Republican states didn't want to report it, but I don't know, because who knows these days. But it was a lot of the reason why the SNAP benefits had such a hard time is because those states didn't opt in for that reporting measure, and it all is tied to the immigration.
So guys, if you're in California, guys and gals, whatever you want to, I don't know, call yourself. Can we just talk about what are you using, or what are you required to report? I'd love to know. Like I said, I worked in the state of Florida. We're required to do, reporting to the state that includes social security numbers. We were required to actually collect a certain percentage of social security numbers, and we're held accountable to the state, could delay our Medicaid and Medicare payments if we did not report in a certain number of social security numbers. Very controversial, I know, but that is the reality. The point is that they're saying the state of California says that there was an improper claim of like over $50 million because billing was tied to an immigration status. So that is very, very, very big.
Suspect.
That is a very, thank you, sus.
Yeah.
Let's use the new term, right?
Yeah.
So billing errors like
well,
that, it's crazy, isn't it?
yeah, I mean, because I mean, at that point, it is literally just showing the corruption out there. You know, it's not. I mean, the system is fraud. I mean, it's exposure. It's, you know, it's not billing errors. You know, and again, if the if providers are caught at this level, you know, they are prosecuted.
Exactly.
Right?
So, yeah, no, for sure. So let's talk about some whistleblowers that were exposed in this facility's Medi-Cal enhanced care management program. So non-clinical staff was managing complex patients. There was no coordination. There was missed infections, delayed treatment. Okay.
Yeah.
So they ended up doing this
on.
like research. Yeah. So they ended up doing this research and then they reported outcomes that included preventable infections, even amputations. People were dying. And I'm sorry, like,
Wow.
if how do you have non-clinical staff managing patients? That doesn't even make sense. Like, business people, administrative people, like, we do the paperwork. We make sure your policies are aligned and all that.
Yeah.
But Lord knows I'm not touching a patient. Lord knows I don't want to be responsible for somebody's care.
No, do not want to be at all.
So
I mean,
now
yeah.
Go ahead.
No, it's just a lot, you know, because when you're thinking about it, the fraud is just widespread.
Exactly. And fraud on all kind of levels. Like, you're not licensed, but you're still like managing a patient. But anyway, so you have it overseen supposedly by licensed providers or whatever, but the system is still failing, still causing problems, still hurting patients, right? So, all right, what else can we talk about? California never stops pouring, girl. The tea in, again, 2024. So this is all recent stuff. We got a hospital, girl, that paid a $10 million settlement to resolve a False Claims Act allegation because they had unnecessary inpatient admissions, physician bonuses tied to admission volumes, diagnosis upcoding, plus a 5-year corporate integrity agreement.
That's what happens when, you know, clinical judgment is out the door, babe. Out the door. And all they care about is the money.
Right. And like,
I mean,
I was recently talking to, go ahead.
No, go ahead. I'm listening.
I was recently talking to a CEO and he was talking about, oh my goodness, 10% of our patients that came through the ER were admitted and blah, 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 blah. And I was like, oh, that's good, but that's bad at the same time. So, administration is always going to look at your metrics. And I understand that in order for a hospital to make money, you have to have sick people. So we don't want to be happy that there's sick people, but we understand it is a business and we do have to run. You understand? And it is all about the metrics. But you cannot falsify. You cannot admit someone that doesn't need to be admitted. Right?
Yeah.
Isn't that like basic?
Yeah. I mean, let's just say this. California didn't fail because doctors weren't licensed, Nylene.
Okay.
I mean, it's the fraud. It's the misuse of funds. It's the, all the way up to the governor. I mean, because, the fire, there was some misuse of funds with the fire people that had happened. I mean, so it just seems like that is a common, thread to go through California. But not just California, our government, it's just, misusing of the funds, and then we are supposed to account for every little dime at every little point, right? So, I mean, it's
That's
just
a good point.
the world we live in today is just. Is this
No,
crazy?
and that's a good point because we did give kudos to the actual medical board. So they're doing the credentialing as far as like privileging all, and we're giving kudos to them for allowing a safe place. But then because they do a good job on that side, then what are we doing with the Medicaid and the billing and the fraudulent stuff? So,
because, having a license, you're not protected just because you have a license, right? Mm-hmm. Like we said before, it's like that is not what is protecting you.
Right, exactly. So systems do. And that's just it. When credentialing isn't used as an early warning system, then you don't get the audits, you get the scandals, you get the settlements. And sometimes, unfortunately, you get bodies, and I don't want to say it like that, but like people can like die as a result of this, this situation that can happen. So kudos to California for having an amazing website, having the ability to do all of that. But we need to focus on billing practices is what we've revealed. Billing practices, vulnerable patients.
Communities,
vulnerable communities.
Mm-hmm. Yeah, I mean, I'm gonna look at it. It's just the neglect is a program design, right? And so it looks like a system kind of design, a system that is designed this way. It creates this problem. Why does it keep happening? And so you have strained resources. Medi-Cal is just overwhelmed. Like you said at the beginning of this episode, the most providers in the United States in one area. And then on top of that, you're going to say that there's still provider shortages because everybody wants to move to Cali. And especially in the realm of your mental health. I mean, always mental health is always going to have a shortage because it is just now being treated as a real, area of medicine. California is literally borrowing money to keep Medi-Cal afloat. And so when you have that, you have fractured care, data silos, it just creates this incredible machine that is so big and nobody wants to fix it. I mean, administrative chaos, right? It's like, this is what we have to do to fix it. And like you said, it takes a lot to fix systems like this. I could give you a plan. We could give you a plan. We could fix this. We could help you. But it's like, now we have to, once we come up with the plan, we got to actually go through the plan and work the plan out. And it's going to create uncomfortableness. And who's responsible? Nobody's responsible. Who's responsible? Because the patient pays the price at the end.
Absolutely. Absolutely. So if you are in California, we understand already that you are in there, you are on it, you got it. Like,
you're in there.
You're privileging, you're credentialing, it's all amazing. What we want is the tea on the backstory of billing practices. So if you're an MSP that does provider enrollment, or you are involved with any kind of like billing, how are you handling utilization, first of all, because we did talk about utilization,
lots
claims
of it.
review, and then do you accept Medicaid? How do you enroll with Medicaid? And what does that look like as far as billing practices? I'm really, really curious to see how that works in California. And that's what we've discovered. Y'all do a great job otherwise, but...
Well, I mean, really, it's not, MSP's fault, right? Because when you have financial mismanagement and federal fraud is being exposed all around you, that creates operational collapse, your staff shortages, your data chaoses.
Right.
And, the scale dysfunction across millions of lives in California, right? The harm isn't something that we're like making up. I mean, it's something that's being happened today. And MSPs in California, we want to know how you're dealing with it all, y'all.
Yes. So we need y'all to engage. Let us know. Did we miss the tea? Is there some crazy story? I'm sure there was another crazy story I missed, but
tell us.
Please let us know, because we are spilling the tea across America. We want to hear. Now, we did talk to Emily, so if you missed that episode, go back and listen to Emily's episode. She's an attorney out of California.
Out of
did
California.
spill some tea and some doctor stuff. So we'll be touching base with her. I'm sure she'll love to hear our California episode, but we want to hear your MSP side. So please reach out. Let us know.
Yes.
Reach out. Let us know. Tell us what we missed. We love you guys and talk to you guys soon. And we'll see you next week on our next
next state. Oh my God. I think California. We're not going too far. Where are we going? Colorado?
Colorado.
Ooh, okay. With the Cowboys. Okay. Till next time.